everyone, I'm Dr. Sanon. I'm a cardiologist. Buckle up because today we're going to dive deep into your heart to discuss a silent killer, aortic stenosis. Now imagine your heart as a pump, pumping blood throughout your body. The aortic valve is the main valve that controls the flow of blood from the heart to the rest of your body. Aortic stenosis is a condition in which there's a narrowing in this valve. Think of it as a kink in a garden hose, less water pressure. Now, aortic stenosis can be sneaky. However, some of the common symptoms to look out for would be shortness of breath, lightheadedness or dizziness, chest pain, or even fainting. If you experience any of these symptoms, you need to call your doctor. Early detection is key. You might be surprised to learn that aortic stenosis is actually fairly common, especially in older adults. It's very important to be aware of this disease and the symptoms, especially if you have a family history of heart disease. There are 3 treatment options for aortic stenosis. The first is medications, but this is not a permanent fix because aortic stenosis is a mechanical problem. The second is surgical aortic valve replacement, and this entails open heart surgery. And the third is transcatheter aortic valve replacement or catheter-based therapies. Now, these are minimally invasive and non-surgical. So which of these is the best treatment option for you as a patient is determined by using a shared decision-making heart team approach. A revolutionary procedure known as TAVR, which stands for Transcatheter Aortic Valve Replacement, is able to replace your faulty heart valve without the need for major heart surgery. Let's look at a quick animation and see how this procedure works. Before the procedure begins, your doctor will give you anesthesia or a mild sedative to make you comfortable. The entire procedure only takes about an hour or less. The arteries in your body are like a system of roads which all connect from the heart. So there are different routes your doctor can take to implant the TAVR valve, and each route comes with its own pros and cons. These routes typically include an artery in your leg, an artery in your shoulder or neck, or a space between your ribs, and your doctor will select the safest route for your specific anatomy. In a typical transfemoral TAVR procedure, your doctor will enter an artery in your leg with a small needle and then inserts a small flexible tube with the valve on it over a wire into your heart and across your diseased aortic valve. The valve is then released in a very controlled fashion, as you can see there, and immediately after deployment, this valve starts working and takes over the function of your old diseased heart valve, efficiently allowing the blood from the heart to be pumped into the rest of your body. To complete the procedure, the flexible heart tube is now removed and the access site is now closed. There are 3 different TAVR valves which are commercially available, and your doctor will select the right valve for your specific cardiovascular anatomy. TAVR is a great treatment option for patients that may not be a good fit for traditional open heart surgery. Your cardiologist will assess you on a case-by-case basis to determine if TAVR is a good fit for you. Compared to open heart surgery, TAVR offers a much faster recovery. In fact, most of the patients that undergo TAVR only spend a night in the hospital and they're home the next day. However, recovery does take time, and it's important for you to follow your doctor's instructions to make sure that you have a smooth recovery back to health. Aortic stenosis may sound scary, but with awareness and with great procedures such as TAVR, it is now possible for you to take control of your heart health. If you have any questions, leave a comment below, and don't forget to like and subscribe for more exciting heart health content. Until next time.